Good morning, everyone. It is Thursday, February 24th. Welcome to the Morning Medical Update. Thank you so much for joining us here on Facebook, Twitter, and on YouTube. Today, a big change in the way the long haul clinic here at the University of Kansas Health System runs. Dr. Keith Sale, Physician VP of Ambulatory Services, he's going to join us with how the clinic is now transitioning into a new phase as we begin to live our lives in this, quote, new normal. The changes aiming to make it easier for those with long haul syndrome and what you need to know starting today. In our COVID headlines this morning, researchers now have a better idea why those long haul symptoms have trouble with people who have trouble breathing and exercising at the same time. A study in the medical journal Chest from Yale New Haven Hospital finds the problem stems from the body not being able to get all the oxygen created by the heart and the lungs. Makes sense. Even though the body is putting out as much oxygen as needed, it isn't being absorbed into the muscles. Researchers hope the findings will shed light on long-haul COVID-19 and help validate patients' experience. Some not so good news for both men and women when it comes to COVID. Researchers at Loma Linda University Health say women are more likely to have long-haul symptoms. However, men are more likely to die from the virus. They don't know why this is, but they believe it has something to do with the biological and hormonal differences between men and women. Most women report long-haul symptoms in their lungs and in their hearts. For the last several weeks, we have been focusing on the impact of COVID on hospital staffing. According to the Kansas Hospital Association, the percentage of staff out due to COVID has fallen by 12% in the last few weeks. And with more staff back at work, hospitals are not being forced to limit as many services as they were about a month ago. The Kansas Hospital Weekly Staffing Pulse Checks finds that percentage has fallen nearly 20% from January 21st. All this is good news for patients as the COVID surge appears to be easing. A live look now outside at your roads as the snow is starting to fall here in the KC Metro. Forecasts are calling for like a dusting to an inch of snow. Not expected to be too bad, but if you think it's best to reschedule your appointments or change them to telehealth, go ahead and do that. Call your doctor's office first thing this morning. And if you choose to venture in, please allow yourself a little extra time this morning. Be careful out there. So make sure also you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. Links can be found right there on your screen. Now, time for Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count. Good morning to you.
Hi, good morning.
Hi.
Yeah, just looking forward to all that new COVID research and updates. So it'll certainly be interesting in the next few weeks as we have hopefully more information about Omicron, about vaccine effectiveness, about long haul, all that stuff. So hopefully cases will continue to go down, hospitalizations will continue to go down, and we can look forward to that information. Just as hospitalizations are continuing to go down, ours have been down for the last, say 7-10 days at a good pace. We are now in the mid-40s, holding steady there. We have 45 active infections with 9 in the ICU, 2 on the ventilator, and 78 in that recovery period as well. So a total of 123. But overall, our acute active infections are down, and that is overall good for our hospital, for our frontline workers, for the patients who aren't coming in because they're not having to. So overall, continue to have those good trends.
We like a little bit of good news. Thank you so much, Doc Hawk. All right, any reporters on the line today? None today. All right, we'll get to community questions here in just a moment. It is estimated 20 to 30% of people who had COVID also experience long-haul syndrome. In fact, more than 2 million Americans are experiencing long-haul symptoms so severe that they're unable to return to work. Thousands of people in the metro are among those who are dealing with long-haul symptoms, ranging from breathing issues to heart problems, all sorts of things. And we here at the health system started a long-haul clinic to help those who needed to meet with a specialist. Now, with COVID numbers on the decline, there are a few changes to the way our clinic works. Joining me now to talk more about those changes is Dr. Keith Sale. How are you?
Great, thank you. Good morning.
Good to see you today. First, let's just talk about why our clinic is transitioning.
So if you go back to when COVID started, right, 2 years ago, about 12 months after that, we began this long-haul clinic process. And so that was about 9 months after what you would think of a 3-month window for what is designated as long-haul syndrome, right? And so we really didn't know at that time how best to move patients through our organization because we really didn't know what all long haulers was. Right. And so as we started to think through it, we put together a small team of dedicated triage specialists, a small team of physician specialists to really try and determine the best way to help our patients navigate our system with these complex conditions. And if you remember, we've had a couple conversations now about long haulers. Over half our patients required more than one specialist to try and solve their complicated issues. And so as this last year has gone by, we feel like we've now begun to really hit our stride in terms of identifying the best way to move patients through our system and through our processes to get them to the right specialist. And so rather than having that small team of kind of navigational experts, if you will, we now, I think, can transition this to our typical or our standard call center team to then direct patients to the right specialist and really actually opening up more access to our teams.
So really expanding and to no effects on the patient. I mean, they really won't notice any changes.
I really hope our patients don't really see a big change. I think it's still, if you look at the referral process, we're still asking for this to go through your primary care physicians. You know, your primary care physician is your biggest advocate in all of this and really is the one person who, in those first 12 weeks, is going to help you identify what things really need to be prioritized for additional evaluation. And so that's then the person we rely on in our process to help differentiate where you should be going within our system. But hopefully the patients don't see a big difference.
So let's take a look back. You mentioned, back 2 years ago, it's certainly such a mystery as we started to learn more about COVID and the after effects. But you said it was about 9 months that we started realizing there are these long haul symptoms. And when did you realize that we may need to put a clinic in place to help these folks?
Well, reports of persistence of symptoms began within 3 or 4 months after, the acute infection. Everybody thinks, well, the idea was, this is just a common cold. Well, clearly it's not, right? And so shortly afterwards, this began to appear, and then much like we see in the hospitals, right, where there's a delay from acute infection to the hospital numbers rising, there's a 3-month delay in acute infection to post-COVID showing up.
Yeah, you call it kind of the tsunami effect.
Exactly, right? So what I'm a little bit nervous about, right, is we've seen this massive surge now, and we saw that little blips in a couple surges over the last several years, but we've seen this big Omicron surge, and I'm worried that 3 months from now we're going to see the tsunami effect of patients with post-COVID. It's really going to require more of a community response, not just a health system response. We'll be obviously a big part of that, but I think it's going to require a lot of community support.
What therapies have you noticed really working in the long haul clinic? What has really stood out to you as been so beneficial to these types of unique patients?
What I'll tell you is there's not one specific treatment that we've found that makes a difference because this impacts our post-COVID patients so variably. The way we treat our patients and triage them is obviously unique to the patient's individual symptoms. And so the one thing that we know is the best treatment for this is prevention. And so I think obviously vaccination is your number one way to try and minimize the impact of COVID, whether that is before you get it or even after you've actually had post-COVID or long-haul symptoms. There is good information that suggests vaccination at that point actually can make a big impact in improving your symptoms. Beyond that, it really comes down to the specifics of your individual symptoms, and I think the treatment plans really vary from person to person.
We had the pleasure of having one of your patients on earlier this week, Stephanie. She was our long hauler that we had on, and we really appreciated her sharing her story. Just what other stories and what else are you hearing from these, again, unique cases and what they're going through?
What I would tell you is the single biggest challenge I think most patients have is advocacy, right? Is how do I, number one, get people to understand what I'm still feeling and what I have, because a lot of these are fairly vague symptoms, and a lot of them tend to be psychological, in that they're struggling because the symptoms, they feel them, but a lot of times the tests come back as normal. I think you heard Stephanie talk to you about how, look, I have all these symptoms, I feel all these things, but yet a lot of my numbers look okay. And I think sometimes as physicians, we tend to rely on treating numbers or tests as opposed to patients. And I think it's an effort at being your own best advocate, and then really, truly, I mentioned your primary care physician. It's partnering with that primary care physician to be your quarterback, to be that care provider who can be your advocate along with yourself to really kind of push additional treatment options or care.
Where do you see long haul syndrome going? If we just looked, we just look months ahead, but when we start thinking several years down the line, what is your thought now? That could change because there's a lot we're still learning, but maybe what are your concerns? This is going to be something that we deal with lifelong?
It's kind of a loaded question, Jess.
It really is. That's what I give you.
What I would tell you is I think the biggest issue with long hauler syndrome, my biggest concern is it's going to become a chronic condition. Right, and that is going to now be on the forefront because there is a very timely cause and effect, right, between COVID and an infection. We've been dealing with other kinds of syndromes or chronic conditions like this, where you think of chronic fatigue syndrome or fibromyalgia, other things that exist that are similar to this, but not exactly the same. And there's some initial questions out there, were some of those kinds of things related to post-viral syndrome? Well, there was hard to draw a cause and effect relationship. But with COVID, there's a pretty clear cause and effect relationship we can draw. It may help us long-term, identifying therapeutic ways to manage this. But over the next 1 or 2 years, maybe even 3 or 4 years, it's hard to predict if there's going to be an easy answer. One of the biggest frustrations for physicians, our goal is to help our patients, right? We want to be able to, you come in and I can provide you a care plan, a treatment, an exercise, a medication that makes you better. As a surgeon, I can operate on you and fix something, right? With post-COVID, a lot of it is not necessarily easy to fix. There's not one solution, and it requires a lot of in-depth work with those patients to really try and solve problems together over time. And so it is not a quick fix. And so that, I think, is the biggest challenge for providers, is not saying I can just give you this medication or give you this treatment plan and you're better.
Right.
It is, we're going to be working on this probably for months, potentially years to come. And I mentioned the tsunami that could be coming after Omicron. It truthfully is going to require community support. And there are Facebook support groups, there are community support groups, hospital support groups. Those folks are going to become increasingly important as the numbers of post-COVID patients potentially grow over the next several months to year.
I was telling you before we started the show that Stephanie, your patient, one of our other long haulers who watches our program, had reached out and said, oh my gosh, I relate so much to her. Can I get her contact just so I can have a connection, so I can have somebody to say, yeah, I'm going through that too.
Right.
Must be really, really frustrating. A question I had off the top of the show, we talked about men and women experiencing different types of symptoms. Do you notice men or women going through COVID clinic experiencing more different types of symptoms, or is it kind of a mixed bag?
I'd say right now it feels like it's still a mixed bag. I think there's good information to suggest that women obviously are disproportionately affected compared to men. I think in my own limited experience, I feel like I've seen more women with long hauler syndrome than I have men. It's hard to know if that's an accurate reflection of the community because it's still so early, I think. So it's hard to judge for sure, but I think really it is something that really is an individual treatment course. I don't know how many people are just saying, I'm just going to cope, I'll just deal with it.
Right.
They might not even recognize this is a post-COVID condition. So it remains to be seen where this goes over the next several years.
So you're an ENT specialist. So did you, in the beginning, people were coming to see you because of taste and smell. Does it surprise you, as this is just, from those initial symptoms that we talked about initially, and then how it's grown into all these other type of deeper symptoms?
I see traditionally we would see a lot of viral illness trigger loss of taste and smell. So for us, this time of year, that was not unusual. I would tell you we sometimes, maybe there's been a little bit of an uptick with post-COVID, but ultimately I feel like it's more now a direct cause and effect, like I mentioned before. They can say I tested positive on this date, I lost my sense of taste and smell, I know it was a viral illness. And so you can potentially remove the need to do additional testing like an MRI or other things, where when someone comes in 2 or 3 months later, it's hard to know if the actual illness caused temporarily those symptoms. So that's been beneficial, but in terms of overall saying it was a big difference for us, no. I think knowing the impact that COVID has had on the multiple systems across the body in the acute phase, to me that is not a surprise that we're seeing some long hauler syndromes that relate to those other issues as well.
How's burnout with staff? Let's talk about that.
You're asking a lot of loaded questions
I know.
today, Jess.
Let us have it.
I know,
us.
right? Just Stites isn't here, so you're unloading on me,
I
right?
am, 100%.
So I would tell you it is a real struggle in healthcare right now. I think, a lot of providers see this dichotomy between their workplace and their home and their community, and it's hard to reconcile that a little bit. Because of that, as an organization, we have really pushed to the forefront a lot of our wellness initiatives. We have a dedicated team with Terry Suey and Becky Lowry leading it, who are really trying to bring awareness to burnout, even more so than it existed pre-COVID. I mean, it was a problem even before COVID existed, and this has just exacerbated that. So I think, as you've heard about the Great Resignation, I think most folks have, it's not any different in healthcare. In an already strained environment, our concern as the leaders in healthcare is that our employees, our clinicians, they're running out of gas, and they just don't see an end in sight sometimes, and so that's a struggle.
Well, and we use the word burnout. I just feel like we throw certain terms around
Yeah.
burnout. Oh, I feel burned out about this, but this is a real thing among healthcare providers. How do you take care of you? Another loaded one for you.
Yeah,
How
right.
do you keep from burning out? How do you stay sane through a pandemic?
For me, it is going back to the little things. It's trying to make sure you save time for non-clinical stuff, non-work stuff. And it is getting up in the mornings to work out, or shifting my workout schedule to the evenings or afternoons just to get something in, whether it's even a 10-minute or 20-minute workout. Sometimes can help. Sometimes listening to a book on tape on the way from home to work or work to home, just to take your brain off.
Like make
Work
yourself
stuff.
make time for it, right?
You really have to almost schedule it.
Yeah.
Right. And so I think that's the biggest thing for me is just I have to schedule free time for my brain. I have to schedule time even for, sadly enough, for my family. Right. And so, but it's making sure you're taking time for those important things in your life.
Makes sense. Okay, we talked about the tsunami of Omicron before we get to our community questions. What are your concerns about the BA2 variant? We talk about another variant. We say more variants are going to come. We haven't even seen the repercussions of Omicron, and we're already talking about another one.
Yeah.
Thoughts?
My personal thoughts are, I don't think it's any different than the other variants. I mean, it's coronavirus. It's it's COVID. Whether it's this version, the last version, the next 20 versions that will come. The plan, the playbook is out there, right? The playbook is get vaccinated, prevent serious disease and hospitalization. If you've had the disease, get vaccinated because it may help prevent long hauler syndrome or mitigate some of those symptoms. So there is a playbook out there. And so I think this is long term. What we have to begin to recognize is starting to use the playbook more effectively.
Yeah. Learn from variant to variant. Dr. Hawkinson, jump in, because we do get a lot of people concerned about, variant to variant, and the death rate and contagious, and people get really nervous about that. But can you make us feel better about it, or do we just need to learn to this is life, this is how it's going to be?
Yeah, I mean, there's a lot of questions there, but I think I would agree with Dr. Sale. We know how to protect ourselves. We are gaining population, but also individual immunity and how our body interacts with the virus and the infection. And the safest way to go about that and gain immunity is through vaccination. We also do know that previous infections do help. In fact, those people that have had previous infection and vaccination seem to have that hybrid or that really robust immune response as well. So I think that's important to understand. And we are moving through that where more and more people will be vaccinated and or infected or both. So I think overall, hopefully, that will help keep people out of the hospital and out of the ICU, of course. I think the overall spectrum of disease is really going to be the same. Remember, when they do talk about decreased severity of Omicron, that is mostly in the context when you compare it to Delta, which seem to have a little bit higher risk of severe disease. So I think that's important to know. But we definitely have the playbook, and we are gaining both individual and population immunity by vaccination and previous infections. So if we can do that, if we can get the people who haven't been infected and not been vaccinated, get them vaccinated, that is important. If you have been infected, please go get that, get additional dosing for vaccine. That will help give you that hybrid immunity. But overall, moving forward, I think we are all optimistic that any new variants that do come through, we will be able to help protect you from that hospitalization, severe disease, due to our immunity, as I've just kind of discussed. So, but overall, I think we're optimistic. We'll just wait and see what happens. But overall, keep people protected. We know that the masks and a lot of the restrictions are coming down. That's an okay thing, but understand that individually you have to understand and judge the risks and the benefits of anything you're doing. But please, go get vaccinated. That will help protect you.
Let's get to some community questions today. Okay. Ashley wants to know, have we seen any long haulers heal 100%?
I would say yes. I think, if you think about long hauler syndrome beginning at that 3-month window, I was thinking about this a minute ago before you even asked that is, what does it look like for long haulers? Ultimately, I would say the majority of them get better. Okay. But it's more about time and sometimes some directed therapies that can help. But truthfully, it is mostly about time. with a lot of our clinicians, and support, right? It is whether it's support from your family, support from the community, or support from healthcare experts when you have specific conditions.
I didn't know how you were going to answer that, but that is some good news to hear.
Yeah.
That yes, that it is
Yeah.
possible. I think that gives people hope.
Absolutely.
Sandy wants to know if a person who has a long hauler syndrome has a PCP, a doctor who doesn't believe it's really a thing, can they self-refer to a clinic? What advice would you give someone in that?
That's tough.
That is tough.
Oh boy, that's a hard question to answer.
Change doctors?
Yeah, well,
Yeah.
in all honesty, I mean, I think when healthcare is a partnership, and when you talk about your primary care physician, if that partnership isn't working, like any other partnership, maybe you need a different partner, and that's okay. That's not good or bad. It's just the way life works sometimes. If you talked with Stephanie, I think earlier, I think she would tell you early on it was a struggle to really get across her symptoms and to really begin that partnership with her physician. But ultimately, through a series of conversations, they came to agree on this is an issue that we need to deal with together, and that's how it moved forward. If you're unable to do that with your primary care physician, I get that, and obviously everybody's entitled to their medical opinions, but I think if you feel like this is really a problem, looking for a second opinion or another primary care physician may not be a bad idea.
That's a really nice way to say what Dr. Hawkinson says. Change your doctor. But that was a really gentle way of putting that.
Yeah, and I think it's hard to understand too exactly what does that mean when they say they don't believe in it or anything like that. Obviously, if you're having symptoms, we deal with people who come in with symptoms all the time, and we have to evaluate them, not just for long COVID, but for in general when people are seeking medical help. It's because they're having symptoms. These types of things are not any different. The long haul is not any different from anybody else who comes in with symptoms. They should be evaluated comprehensively so that we can get an understanding of what truly the disease process is and how we can help.
Well, and people prior to COVID would tell you, and I think a lot of folks didn't think fibromyalgia or chronic fatigue syndrome was the thing.
Yeah.
Right? And so there's a long litany of diseases and conditions that are out there that prior to years of being around, people had to learn to believe in it or be convinced to believe in it. So I don't think this is any different in that respect, but I do think it's going to take some time for folks to understand it and really feel comfortable. This is, like I mentioned before, this is the hardest thing for physicians. When everything looks okay, when your tests are fine, your exam is normal, but you still feel like crud, how do you help patients with that, right? And that's truthfully is one of the biggest challenges as a physician when we see folks like that.
I'm so glad you brought that up because you're right. We go back and we hear some of these other issues that people have, and if you don't experience them yourself or someone who's experienced it, you're thinking, what is that? Is that made up? What's wrong with you?
Yeah.
Is this hypochondria?
Yeah.
So it takes learning and time, unfortunately, for those folks. But Kitty is asking, I think I know the answer to this question because Dr. Castro was on earlier in the week talking about the long haul trials.
Sure.
So she's asking if a person who lives in another city can participate in long haul. And I believe he said that, yes, they are encouraging people who live in smaller towns to participate, correct?
Absolutely. No, they're taking any and all comers. And so they do have a process to screen patients to make sure they are appropriate for the study like any other study would. But I think ultimately, yes, they're looking for folks, not even just long haulers. If you've had symptoms for as short as 4, 5, 6 weeks,
right,
up to multiple months out, they're looking for a broad range of patients to really understand this process.
A very open trial. Okay. Vicki has a question, Doc Hawk. Any word yet on timing for another booster? I'm 4 months out from her booster. She's not immunocompromised. Just give us a quick booster update.
Yeah, for non-immunocompromised, really that 3 doses, that first 2 of the primary and then the third dose for that booster, you're only 4 months out. Really we have good information about booster doses even up to 6 months. You're still very well protected. There is currently no recommendation now for additional dosing for non-immunocompromised people. So you really should be good. And remember, during all of this time, your immune system is continuing to evolve and create those further memory responses, those memory T cells and B cells. There is a camp that thinks that really with those 3 doses, you should be good and you really shouldn't need any further boosting. But then there are the camps who say, well, maybe we'll need a booster every 8 to 12 months. Currently, the data is not out on that. Hopefully, we will have some time to gather and analyze this data now as we are coming down off of the Delta and Omicron surge. But right now, you really should be well protected with that booster dose, even at 4 months out.
All right, and Neil, good morning to you.
Yeah.
He's also one of our long haulers who watches every day, and he too has been trying to convince people this is a real thing. He wants to know, is there a reduced percent of long haul symptoms between vaccinated and the unvaccinated population? Do we know anything about that?
I'm not sure I understand the question, but I would tell you that, and Dana can please weigh in. We know. I think if you've been vaccinated and then get ill, it seems like there's a less likelihood that you will have significant long hauler syndromes. I think, in addition to that, if you have long haulers and you get vaccinated, like I mentioned earlier, it can help mitigate symptoms, and some folks even resolve them. Dana, your thoughts?
Yeah, I mean, I think that's exactly right. We have a few and a couple of very well done studies, peer-reviewed, that would support the fact that the people who are vaccinated have a reduced chance of having long haul symptoms, even up to 50%. So, but then you also go to, can vaccine sometimes be treatment? Just as you said, we've seen people with long haul symptoms who've gotten 1 or 2 doses of vaccine and do have an improvement or resolution of their long symptoms as well. So, but that question is still being looked at and answered. I haven't seen any formal publication of data on that aspect.
But I have heard a couple of people, will write in and say, I've had some symptoms, I got vaccinated, I immediately felt better. So the power of vaccine.
Anecdotally, it's out there for sure.
Right. Okay, couple more questions, and let me see. Okay, does Paxlovid have a positive effect on long COVID symptoms?
Ooh.
Do
Not sure I didn't
we
see
know
anything on that
anything
one.
about
Yeah,
that?
I mean, so Paxlovid is indicated for the acute treatment of COVID-19. So that means really within 7 or 10 days. I can't remember what the exact indication is. It's a minimum of 7 days. So you want to get treatment before those full 7 days of symptoms. Treating earlier is better. We're always advocates of early COVID-19 treatment. Paxlovid will help reduce your chance of going to the hospital, but I think there is no indication, I don't know that it's even been studied in people who have long haul symptoms without acute infection, meaning when they are still in that viral stage of viral replication. Because if you remember, long haul is really about that post-viral stage. When you've recovered from the illness, you've recovered from the viral replication, and really it's just now some immune effects that are creating long haul symptoms, some possibly blood clots, some lack of oxygen. There's a multitude of different factors, but Paxlovid would not be effective in any of those states. Paxlovid is really only effective in that acute viral replication stage early on in disease.
Mary wants to know, do any other viruses have long-term impacts that are recognized other than chickenpox? If so, how has treatment of those post-acute illnesses evolved over time?
I'm going to defer that one to Dana.
Yeah.
Ooh, we tossed it over.
I mean, so if you're thinking about, there are a lot of diseases that can do that. I mean, simple ones very common in the community would be something like herpes simplex virus infection, where people can have outbreaks or flares of that, cold sores, things like that. We know, she mentioned shingles and chickenpox as well. We know that in certain immune suppressed people, we can have viruses reactivate, such as CMV or EBV. So those things can happen, but if we're talking about long haul or persistence of those chronic symptoms, I can't recall anything off the top of my head in the same nature that we've seen SARS-CoV-2 do. But we also know that when people are severely ill in the hospital, say with influenza, they can have persistence of things like fatigue, not feeling good, shortness of breath for a long time. And some of those consequences are just a consequence of being severely ill as well. So sometimes it gets hard to really denote exactly, is this the virus or is this because of your severe illness? And we know people with COVID-19, even with mild symptoms, can have long haul effects as well.
Yeah, as I mentioned earlier, I think the biggest difference with COVID and other viruses, we can put a direct connection between a positive test for a viral illness and potentially a symptom that occurs afterwards. Most of our viral illnesses, we don't have a guaranteed positive test, or we don't test routinely for the common cold or for any other upper respiratory tract infections that occur in the population, unlike COVID during the pandemic. And so we can really draw that connection with COVID, which I think is helping us validate, in some respects, some of the things we thought were viral related in the past but couldn't prove. So I think it's been really interesting in terms of from a research standpoint to see that.
So that leads me to my next question, Pat. This would be very frustrating. Every COVID test I have had has been negative, but I have had chronic symptoms for quite a while without any real specific reason. Is it possible that I have long COVID without ever testing positive for COVID?
That's a good question, but I think a really hard question because there are a lot of other things that can cause these symptoms. And so I go back to this is where it is so important to work with your primary care physician because there are a lot of things that the primary care physician can rule out, can begin to kind of identify as other possible sources, whether it be metabolic or other things within your system that could be triggering those exact symptoms. And so is it possible that it's an undiagnosed COVID infection? It's certainly possible. But with multiple negative tests, to me, you start to wonder, okay, what else could be going on? Are there other things we should be evaluating and looking into? And again, that's where that primary care physician becomes critically important.
There's other things than COVID that needs to be checked out.
Absolutely.
A couple more quick questions. Dr. Hawkinson, Kitty wants to know, is a person who has chronic kidney disease considered immunocompromised? Because we talk about high risk versus immunocompromised. Tell us about that.
Yeah, we wouldn't generally consider you immunocompromised. We would consider you high risk for progression to hospitalization and severe disease. Right now, you would not necessarily meet that criteria if you're immunocompromised if we are talking about requiring further vaccination or vaccine doses. But just as you said, Jessica, you would be high risk for progression to hospitalization and severe disease, but you wouldn't necessarily meet that criteria for immune compromise when during immune compromise we are looking at what is the function of your immune system itself, whether it's the B cells, the T cells, the natural killer cells, what have you. So you would be at risk of progression to hospitalization and severe disease, but you wouldn't be considered immunocompromised for the purpose of requiring additional dosing of vaccine. At this point in time, again, we're always waiting for updates from the CDC and ACIP on their recommendations.
Great questions today. Thanks to our community for those. Let's get to some final thoughts. Dr. Sale, thanks for sitting front and center with me today.
Absolutely my pleasure.
What do you want us to know? Just anything that we need to know about the long haul clinic, if anybody's having these symptoms, where they should go, how do they proceed?
You know, I think it still starts, like I mentioned, I think if I said it multiple times than you probably wanted to hear, but it starts with your primary care team, right? And with your primary care physician in terms of working through this process, especially in that acute and subacute phase, right? Those first 12 weeks. When you have things that are going on beyond 12 weeks and your primary care physician is looking for extra diagnostic support or help, that's where our specialists are there and ready, and that's where having them refer you to our team can be really helpful. I think this is a condition that isn't going away. It's going to be with us probably for a long time, and we probably haven't seen the peak of the long haulers wave, if you will, because I think, you know, as I mentioned earlier, with this big Omicron surge, the number of folks who had that, I'm nervous about. I feel like we're seeing the tip of the iceberg right now with the first couple of surges that we've had here, and that this may be another surge down the line 3-4 months from now. So I think looking to your primary care doctor, looking to your friends, looking to your family, looking to support groups around town to try and help you as you navigate through this complex disease. It is a thing. It is not something that you're making up. It is not a figment of your imagination. It does exist, and if you need help or you're struggling to find the help you need, keep looking, because there are a lot of resources in the community and specifically here at our health system.
It's very validating to have you sit here and share those words with people out there struggling. So thank you for being with us. Dr. Hawkinson, final thoughts today. Yeah,
I mean, all good questions and good topics today. You know, I think Dr. Sale hit on the biggest thing. We know that people are concerned about BA2 variant. But again, I think, to use his words, we have the playbook, and it is vaccination. We know and have been lucky that these vaccines have provided great protection even against all the variants if you are up to date with your vaccines. And again, if you are not immunocompromised, that would be the 2 primary series doses and then that 3rd booster dose. And it's really that time between that 2nd and 3rd dose that really helps to evolve that immune response and is then boosted by that 3rd dose. If you are immune compromised, we had a good question just a little bit ago. It's 3 doses for that primary series and then that 4th dose for that booster. That will continue to provide protection. If you have been infected, please go get at least 1 vaccine dose. You know, what we have seen in some of the good research articles is that it's really 3 exposures to spike, and whether that's 2 vaccine doses and an infection or an infection and 2 vaccine doses, that seems right now to provide the greatest protection to help reduce your chance of going to the hospital and going to the ICU. So we have the playbook. I wouldn't be too concerned about BA2. We are still learning more and more information about that. It is very early, and we'll just see what happens and how it's able to displace Omicron right now in the United States in particular. We know some of that displacement is going on in other countries, but right now in the United States, Omicron continues to be the dominant variant, so we will keep an eye on that. And please go get vaccinated.
All right, we will see you tomorrow. And here in about 90 minutes, it is a brand new episode of All Things Heart. Joining us now is the host of the show, Alexis Del Cid. Hey, friend, how are you?
We have a fantastic show this morning. I'm going to get to that in a moment because it's super emotional. But first, I want to tell you about some news involving hearts and artwork. In fact, 154 hearts all across the metro that will be on display for the Parade of Hearts. The Parade of Hearts features 154 winning designs out of 700 submissions. The winners are chosen by a special panel. Each giant heart is 5'3" tall and 5 feet wide.
I'm getting close.
A design submitted by a team of graphic designers here at the University of Kansas Health System is one of the winners you'll see on display this spring. It's a comic book style titled Heroes in Healthcare. We caught up with 2 of the artists as they painted.
Just to give thanks and show gratitude towards our frontline healthcare workers. I know they hear thank you a lot and thanks, but I just wanted to give them like a piece that kind of visually represents that. It's just like a huge thank you.
We're really driving home that these healthcare providers are also people, and they are doing their best to help in every way that they can.
After 3 months on display, each heart will be auctioned off to the highest bidder. Some of that money will go to the University of Kansas Health System's cardiovascular and cardiothoracic programs. They're beautiful, and there are other teammates here at the University of Kansas Health System who've also had their artwork selected, so we're going to be featuring those throughout the next weeks. The other team members working on this winning design for this fabulous heart were creative design manager Jeff Spiller, marketing director Amy Metcalf, and website strategist and development manager Marcia Francis. We are so proud of you guys. Can't wait to see your finished masterpiece once it's on display. Now to what's coming up on this morning's show. Bring your questions, grab your tissues. We have such an emotional story on All Things Heart. It's about a rare heart transplant, but an even more rare situation involving a father and a son, both in heart failure, both here on the same floor needing a transplant, only one eligible to get a heart. You will hear from the one who survived, sharing his journey and the incredible legacy that his loved one leaves behind. You're going to hear from his cardiologist this morning at 10 a.m. Again, bring your questions. Jess, it makes me emotional just talking about it because it's such a special story. So I hope that everyone can join us this morning.
And hearing the words from that patient, they're very, it's very touching. I cannot wait to see it. Have you met Dr. Keith Sale?
We have met in passing, but I haven't had the opportunity, 1, to shake your hand because we're in a pandemic.
Because we can't, right, yeah.
But 2, we haven't had a chance to talk. So
True.
It's great
Nice to meet
to
you.
be with you and meet you in person.
Actually, what we're doing, we're auditioning you here to be on her show at a later date. Do you
Okay.
think? I
Fantastic.
think he can do it.
Yes.
You're good. You're going on.
Okay.
I think he's stuck because we put him on the spot.
I'm not sure he's aware of anything below the head, though.
Right, ear, nose, and throat. I have a limited scope of practice,
We'll
right?
figure it
What is
out.
the heart? He's
There's
going to
all
ask
things
you that
hearts.
off
There is
stage.
That's in the
always-
chest somewhere, right?
There's always a heart connection. That's what I'm learning.
Always,
So
always.
we will figure it out. There will be a heart
All right.
connection.
Sounds
Okay,
good.
can't wait. All right, Alexis, thanks so much for that. Can't wait to see that again coming up at 10 o'clock. 10
a.m.
10 a.m.
10 a.m.
Thank you all so much for being with us today. And of course, you can always catch our shows anytime on Facebook, Twitter, and on YouTube. Vaccinations that have protected the public's health for decades are now under attack. News accounts might make one think attitudes towards vaccination have dramatically changed. You may be surprised to learn what this new survey shows. A reputable, nonpartisan group wanted to know what Kansans think about vaccinations and religious exemptions. The results, recently released, are powerful. We'll go over that tomorrow at 8. Everyone have a great day.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.